Welcome to the Trigger Point Workshop. I'm Coach Luke Rudberg with Training House, and we're going to focus on today the hips and the spine. Now, first and foremost, I want to go over what is a trigger point, also called a knot, knot in your muscles. So a trigger point is a hyper-irritated bundle of muscle fibers. Now, this is bad news in two aspects. One, that it decreases circulation to that part of the muscle, and that in turn can increase the likelihood of spasms, and also it maintains all of that metabolic waste that's produced from normal muscle function in that one spot, right? Because there's decreased circulation, so it doesn't allow the muscle a chance to recirculate and get rid of that metabolic waste. So some of the symptoms of a trigger point would be like a knot in your muscle. When you're feeling on your muscle, you find a spot, it kind of feels tough there, right? A knot in your muscle, trigger point, same thing. Another common symptom would be that you're experiencing some sort of spasm or twitch. Not a full-on muscle spasm like your calf in the middle of the night, but something more isolated, right? A little more specific. It can definitely feel painful, like a sharp pain. It just feels like that point is getting caught up. And then it also can restrict your movement, right? When we go through these trigger point release exercises later, you definitely are going to notice an increase of range of motion too if you're targeting some good trigger points and finding some good knots in your muscles to release. Some causes, I like to think of this one as kind of like a yin and a yang. There's two sides of it. One, you could definitely develop a knot in your muscle, a trigger point from overuse, right? You're using that specific part of your muscle. Those muscle fibers are innervating at an unusual amount, right? You're using that spot more than you usually have, a little bit of overuse, and it ends up getting knotted up. On the other end of that is lack of function, right? So if you're sitting around all day, not doing a whole lot, your muscles are ending in a shortened position and they get used to that. So that's going to be their new state. And when they're in that shortened position, become contracted, you can end up with some knots in your muscles, some trigger points, and some lack of blood flow and circulation in those spots. So it's kind of on both ends. One, a little bit of overuse can definitely develop knots or trigger points. And then on the other end would be lack of function can definitely leave you with some knots or trigger points in your muscles. And then the next one would be some sort of trauma, right? If I got hit super hard in one specific spot, getting like a dead leg when somebody hits you on the quad really hard, right? That's a fine example of a specific isolated trauma that can develop some trigger points or some knots in your muscles, right? As your body's trying to go through that healing process, it just gets a little stuck. So anyways, we're going to go through some treatments today, but pain is a signal that you need to go see a medical professional, okay? Massage therapists, acupuncture, even your physician, all great options. Chiropractor, really great option too, to help relieve some of those trigger points and whatnot, because it could be something deeper too. It could be related to how your body is functioning, being misaligned, that can lead to these overuse spots in your muscles. So pain is a signal. Go see a medical professional. They're going to help you out. What we're going to go over today is for mild irritation and prevention using self-massage. So today we're going to go over from the hips and the spine. We're going to hit the points of the iliac crest, the top of your hip, your glute med, your TFL, which is on the lateral side of your hip, the top of your hamstring, its origin, the iliopsoas. That's going to quickly blend into the psoas because those are both kind of related to your hips and your spine. Then we're going to go to the quadratus lumborum, the bottom of your spine, work our way up the spine with the paraspinals, and then finish with our rhomboids, our upper middle back. And I'm sure you're going to find some spots that we want to hit and that will feel good to release and likely to improve your function as well. Before we get into it, I'm going to give you a demonstration here about why you can't necessarily just stretch through knots in your muscles. So the pre-wrap here represents normal muscle tissue. The tape here is representing the knot in your muscle, right? The trigger point. So when I look to apply a stretch onto the muscle, right? And I still have that knot, boom, where's it gonna break? It's gonna break at the point of most tension. So the point, and it's an exaggerated point, but I think you'll get it, is that putting a stretch on already hyper irritated muscle fibers is likely to cause more trauma, right? You're twisting and tearing at a point that really needs release instead of a stretch. All right, time for the practical portion of our workshop today. We're going to go through some trigger point release for the hips and the spine. Now, two tools you're going to want to use. One is a softer surface, right? Because we're going to, have our body, a ball, and then the surface. If your ground is super hard, it's going to increase the intensity. So I would encourage you to grab like a mat, or maybe do this on the carpet or a matted floor. So next up would be the ball. You can definitely have some variability in this. It's kind of, what you can tolerate. I think a good middle of the road option, and what I'm going to use today, is a lacrosse ball, right? But you are welcome to use also a softball, a baseball, lacrosse ball. The tennis ball is a little bit softer, right? The softball has a bigger surface area, so it also decreases the tension a little bit too. And then some of us who are sick in the head, really like pain, they're going to use the golf ball. I would encourage you to start in the middle of the road, and then maybe upgrade to specific things with a golf ball to get like specific spots, right? If you really need to get isolated with it, or you find something that really you need to dig into it too, right? With a golf ball, you're trying to mimic that's like a massage, like somebody's pushing with their fingers, right? That's kind of how isolated it will get with the golf ball. But we're going to go with the lacrosse ball today. And I encourage you to try out a few different options as you go. Today is just focused on education and exploration, a chance to get a good feel for it, so you can use all these tools in training, in practice later. First up, we're going through the hips. We're going to start with the iliac crest. So I got my lacrosse ball, and whatever ball you have available to you, you're welcome to use that. And our iliac crest is the top of our hip. So if I'm feeling on the back side of my hip, there's the top part, right? Just below that is a little bit more meaty. And if I go down from there, that would be the top of my femur, right? So we're gonna start at the hip, and I'm gonna go find that bony part, right? The top of your hip, right there, the iliac crest. We're gonna go just below that, and I'm gonna start more towards the middle of my hips, right? In the direct middle is my sacrum, that's bone. So off to one side near the top of my hip to start for the iliac crest. So I'm going to find that point, right, top of my hip, and I'm going to lay on my side. And from here I can dig around a little bit. Again, I'm trying to follow and trace just underneath the bone there. If your clothes are getting bunched up, you can adjust a little bit too. But you're pretty likely to find a spot, somewhere from the back side, right, to the side, following along that iliac crest, that feels tight and tense, right? That would be the trigger point, right? Some spots, not that bad. And then I move and adjust a little bit, and I find, oh, yeah, that's a tight spot. That's definitely a tight spot. Now, an upfront warning too, as well, is that I'm not looking necessarily for a ton of pain here. You can definitely be compressing nerve bundles, so it's important that you're not doing this into any extreme pain, right? If you feel something shooting down your leg, right, a spark, that's what it kind of feels like. That's kind of when you're hitting a nerve, right? But sometimes you can also compress the bundles between, right, two muscles overlapping, and that can also feel like, I feel it in like almost like a different part of my leg. But I encourage you to go nice and easy so you're not pressing and compressing your nerves too much, but explore on that iliac crest with me to find some of those trigger points. Once you do find a trigger point, I want you to kind of maintain and hold on that spot. Now, some people have you hold up to about 2 minutes, right? That's great to do in training, but today we were just doing a little bit of exploration, okay? Exploration of the hip. When you're doing this later by yourself for more training purposes, more routine purposes, you can definitely hold for up to 2 minutes. I like to hold for just about 30 seconds, kind of breathe through it. Once I definitely start to feel that physiological change of that muscle starting to release, big deep breaths can help you work through as well. Then I like to move on. All right, to explore that hip a little bit, let's get the iliac crest on the other side, and just to give you another little bit of visual, my sacrum is here. There's a bony part of my hip that travels right from here all the way up to the side. That's the iliac crest, right, the arch of my hip. So I'm going to start more towards the sacrum, following the top of my hip, not pushing on the bones, but just following the top edge, the border of my hip there, until I find a spot. Really doesn't take too long to find a spot that definitely has a little bit of irritation and a possible trigger point there. Again, just doing a little bit of exploration. You can definitely go back to any of these spots once the workshop is done and dig in a little bit more. Awesome, so that was the iliac crest there. Spent a little bit less time on this side, I know, but we're gonna move on so we can get through everything today. But the glute med is next, okay? So your glutes in a few different parts, but glute maximus, right? The big part of the hip, and then the backside at least, and then the glute med would be a higher top band up here. That's a smaller part of your glute muscle group. So we're going to take the ball now, instead of riding along the top edge of our hip, we're going to go down a little bit, but I want it to be above the head of your femur. So if the sit bone, right, some people call it sit bone, right down here, right, I can feel the head of my femur right there. I'm going to go up from there, so it's just about there. Kind of, I like to think about it, it's like, you know, when you look at the back pocket, like where your jeans, you got the back pocket, it's like that line of the top of the pocket. That's where I like to place the ball. I actually have a pocket on this, the pants I'm wearing right now, so I'm gonna basically just start there. For this one, I like to sit up, right? I got 3 points here, 1 with my foot, 2 with my hands, as I'm holding myself up. And then as I start to search around, scour around, look for those tight spots along that glute med. Again, think about your back pocket. The top of that back pocket makes a good line for where kind of your glute med is. Once you find this tender spot, then I kind of like to release the pressure with my hands and dig it in. Now, if you're really not finding anything, another thing I like to do, if you're into pain, as I take that leg, the side that I'm working on, right? So I got the ball on my right side right now. I'm gonna cross my right leg over my left, and I'm still supporting myself a ton on my hands. This will give a stretch to some of the glute max muscles, right? The bigger hip muscle, and it kind of helps to expose some of the deeper hip rotator muscles like the glute med. So putting a little stretch on the muscle to kind of access some of the deeper hip muscles a little bit easier if you were not feeling it before. So that's good. Again, you find your spots, hold on them, breathe through it, make sure you're not compressing any nerves, no nerve pain, no sparks flying down your legs. Okay, I'm gonna try out the other side. I'll turn around so you can keep seeing. Got the glute med here, so just above the sit bones, that's your head of your femur. I'm here, right where the top of the back pocket is. Scour around just a little bit, see if you can find some tight spots, and if you can, perfect, you can just hold on that. Some of us might have a little bit more, lateral tension, right? Some of us might be straight towards the back. But scour around, this trigger point stuff is self-exploration. You gotta dig in and find where your body is tight. We all put different demands on our body and on our muscles, so we definitely are gonna get tight in different places. Again, if you find a spot you can dig in and hold, try and breathe through it. Excellent. Okay, we're going to move on from the glute med now. We're going to go to the TFL, right? So TFL, I won't break down that acronym for you, but so think about now we're on the lateral side of the hip. So the head of my femur, right, the other part of the head of my femur is right here. There's a bony part, right? It's almost like where my pocket, we'll use the pocket as a reference again, it's kind of along that line of my pocket, but more towards the bottom, right? That is bone right there. I'm going to go just above that, kind of between the space of the top of my hip. Oh, that's bone right there. That's muscle, TFL. Kind of the start of some of your like IT band muscles and whatnot. Also, it's its own kind of muscle itself too. But anyways, and then right down there is the head of the femur. So bone, meat, take the ball, put it right there. This time I'm going to lay all the way onto my side. And so I'm bracing on my elbow, bracing on my knuckles, and I also got that foot to help support me too. This one, it definitely is really common to find a lot of sensitivity here. So breathe in, breathe out, deep, try and relax. Another option too, if you're not feeling it, like I'm tipped back slightly. So if I need to tip forward a little bit, I can cross that leg over in front, and then I can start to dig in a little bit better if I need to feel a little bit more towards the front of my hip. But again, working on that space between the head of the femur and the top of the hip. You'll kind of feel it if you start to hit the bone, just go either up or down, just adjust from there. All right, again, just self-exploration today. You'll get a chance to go through it on your own once you're well educated. Let's find the TFL on the other side. Oh, and again, on the bone, and I'm on the side of the hip here. I'm not really feeling, oh, there's a good spot. No, yep, no nerve pain. I definitely feel like that is a spot in my muscle that could use a little bit of trigger point release. Okay. Keep digging in there. We're going to move on here in just a moment. Okay, good work. Now we're going to go for the top of the hamstring. Okay, so I'm going to work a little bit more towards the direct backside. So like I talked about the sit bone earlier, the head of your femur, we're going to go just down from there. Okay, so big part of your hip, right? Down here, I feel bone, right? Just above that, or just, I'm sorry, below that is going to be the origin of your hamstring muscle. So it's a bunch of your muscles will flow into a tendon, right? The tendon is at the top here, and this is where that hamstring muscle originates, right? It inserts behind the knee on the lower leg to help curl your leg. But anyways, you're gonna dig in here with the lacrosse ball near the origin of your hamstring, just below the head of your femur, or what some people call your sit bones. This one definitely gets tight. It feels great to just sit and relax onto it. If you are struggling to get a little bit of, to feel the pressure, you can definitely ditch the hands and kind of, once I find a good spot, feeling it definitely right there, then I can lean forward a little bit to, again, apply more downward pressure. Not that it hurts a ton right now, I just know that my breathing can help facilitate a lot more release. Okay, that's good there. Why don't we go try the origin of the hamstring on the other side as well. Give you a different angle here. You can see I'm supporting myself with my feet and my hands, scouring around a little bit. I guess another fine point is you can also turn that foot, right? Me rotating my femur inside my hip socket by doing this, right? You can kind of expose some of the different parts of that hamstring origin. Okay, so I feel like I need to rotate my foot in my case. And then I find a good spot there. Now I'm going to lean forward once again. Breathe and relax. Try and work through that tension. Trying to relax my leg here too. Good, just a little bit more there, and then we are going to move on. All right, that was a good one. I might need to come back to that one later. We're going to move on to the iliopsoas next, right? So, so I talked about the iliac crest earlier, how we trace the backside of it, kind of where your glute max muscles originate on your iliac crest. Now we're going to go for the iliopsoas, right? So right around like the iliac crest, right? We talked about the crest of your hip here. Now I'm going to be attacking from the front. So there's the bony top of my hip, right? Front of my hip at the very top, right? This is more of my abdominals. Below that would be more like my quad, some of my hip flexor muscles. So right here, that's bone. I'm gonna go just inside that, okay? Just inside there. And in this case, I'm gonna lay on top of the ball. If I go too low with this one, I start to feel I'm pushing on the head of my femur, right? The head of my femur right down here. So I'm going just a little up from that. Again, bony top of the hip, that's bone right there. I'm going just in from there. This one you can definitely lay flat, that's fine. This will increase the pressure just a little bit more too. Try and relax and breathe through it. Still not feeling it, you can pick your foot up just a little bit. Still really not feeling it. You can try and lift your leg up a little bit. Yeah, I definitely feel that one. Breathe and relax as you work through it. Again, holding up to 2 minutes. Another good option too is you can rotate, right? Rotate your femur inside your hip socket again. Change the angle on your hip to try and dig it into a different spot. I feel a little bit more if I internally rotate
my foot or internally rotate my femur by driving my foot off to the side. Kind of feel a little bit better of some pressure there with the trigger points. All right, again, exploration, education is the goal today, so let's try it out on the other side. You can definitely go back later. Bony part of the hip, just inside that. Scour around just a little bit. If you end up going a little bit lower, right, you're getting more towards pressing on the front of your femur, the head of your femur, so scour around a little bit higher. So I definitely just found a spot for me. Breathe and relax. You can try the foot rotating method, and you can also try the lifting method. Man, this one's gonna hurt. Yeah, definitely one I could come back to later. Dig in just a little bit more there. All right, good work addressing a lot of those hip muscles there. We are going to move on. A good transition is going to be our psoas muscle next as we move into the spine. All right, next up, we are going to go through the psoas muscle release using the lacrosse ball. Sometimes this one can be a little bit better if you try with a softball first. Getting a little bit larger surface area can help to release it a little bit. If you have one of those SoRite tools, those are great too. It's like a little arch, a little half pipe kind of looking thing, and you can use that to dig in as well. But anyways, for what we're going to do today, I'm going to use the lacrosse ball, and for where I want you to start, I want you to find your belly button, find the top of your hip, right? Bony part, top of your hip. I want you to go halfway between that distance, okay? So it's kind of like my rectus abdominis muscles, right? Your kind of like your six-pack muscles, however you want to call it for your abs, right? It's kind of just on the border of that. That's a good place to start. We can definitely move around from there. So belly button, bone of the hip, top of the hip right there. I'm going to take the ball and I'm going to lay on it. The softball can definitely work a little bit better. It's a little less targeted, but it's you can help it dig through some of maybe the adipose tissue, fat tissue on the abdominals if you need to get in there a little bit deeper. So if you're like, I can't really feel this at all, maybe try a larger ball. The softball would be a great idea. But anyways, in my case, I'm feeling it just fine here. Letting it relax, letting my ab muscles relax. I definitely don't want to fight through that. I'm not trying to squeeze my abdominal muscles. That will definitely hurt, but it's not digging into the right spots. So I'm trying to breathe and relax here. Can move up and down just a little bit, maybe move a little bit closer to my hip as well. Again, I'm feeling it pretty good here too. You can definitely look to lift the leg on the side that you're working, even lift up too, and trying to get that ball to dig in to help release some of the psoas muscles. The psoas, I guess a quick little anatomy part is that it originates on your lower lumbar spine and then runs through and connects onto your femur. So it helps with hip flexion. It's actually a hip flexor muscle. I'm sure there's a lot of other stability roles that it plays too, but so it runs up and down. So if you want to move up and down just a little bit as well, that can help get some of that psoas muscle a little bit better. Sometimes I like to rock side to side. I'm moving opposite of how the muscle runs, right? It penetrates or whatever. But so running across the muscle fibers can also be a good way to help feel where you're tense. And per usual, if you're find a spot of tension, you can breathe and relax and try and hold it. Okay, let's give it a go on the other side. Again, find the belly button, find the top of the hip, going halfway between there. You can also just think just out on the outside edge of the abdominal muscles. Breathe and relax. Scour around just a little bit. See where you feel tight. Definitely an important muscle to maintain good length to it as well. If you sit a lot, right, you're bringing your lower lumbar spine closer to your femur repeatedly and for extended period of times, your psoas muscle can definitely get restricted, get tight, right? Also, There's a lot of thought behind the fact that improper function, right, can lead you away from using your psoas as a prime mover, as a prime moving muscle as well. So this can help definitely improve your function. So it's an important muscle to keep good release to, keep good length to. All right, I've had a little bit enough of the psoas there. For now, we are, and again, we're going to move on to the spine, and I think the psoas was a good bridge between the hips and the spine because it interacts with both, basically. But if you did not feel that much with the lacrosse ball, I would encourage you to use the softball to help, dig through all the tissue, the abs, adipose, and also intestines to help hit the muscles that are on the front side of your spine off to each side. All right, so that was the psoas. We're going to move on to the spine next. We're going to use the lacrosse ball again, and I'm going to start on the floor. Sometimes using the floor can be a little bit too intense, so you're also welcome to do these same maneuvers by standing against a wall, right? Pinning the ball between you and the wall and leaning against it can also be a good alternative. I'm going to stay on the floor for now. We're going to do the QL next, quadratus lumborum, the lower lumbar muscles. So a great place to think about it, to visualize the muscles is my lowest ribs about right here, floating rib about right there. You can kind of feel, right, that's where my ribs end. And then the top of my hip, right, that iliac crest we mentioned earlier. The space between there is a few different things, oblique muscles too, but like we're going to focus on the QL. So I'm going to go a little bit closer to my spine. So the softer, meatier spot between your ribs and your hip, and then closer to your spine too. So we almost need to dig in, right? So I need to go in this way and in this way towards my spine. So let's grab the ball. I'm going to start like this. Find that meaty spot. Good. Move a little bit closer to my spine. Good. And I'm going to lean at an angle. So I'm going to try and dig in and lean at an angle. Feel free to move around a little bit, trying to adjust for where you might feel a little bit more tension. Again, I'm digging in and then towards my spine from there. Not directly on my spine for sure. I'm not pushing against any bone or any nerves there. I'm just working on releasing the muscles that surround the low back, the lower spine, QL, quadratus lumborum. So dig around there. Sure, it's getting in the way just a little bit. Feels like a little bit lower, kind of just above my iliac crest is where I'm really feeling it today. You can definitely lay back too. And then if you're really not feeling it, I'm going to feel this one a lot, but you can pull that knee up towards your chest, right, to apply even a little bit more pressure. As long as there's not a ton of pain, right? I'm not looking for pain. I'm just looking for that pressure release, right? Those knots, those tension points, and I'm looking to apply some pressure on there. Not any sharp and shooting pains. Okay, that's good there. Again, exploration, education, the goal. Let's move on. Let's give it a go on the other side. Find that meaty spot between your lowest rib and the top of your hips. Then I'm pushing up and in against the side of my spine. If you definitely feel it more on the outs, more towards the side too, all good. Dig in there as well. Still really not feeling it, you can lay down. Yeah, it's a little too much for me on this side, so I'm going to sit back up. These muscles kind of fan out, but we mostly run up and down, so I'm just kind of moving up and down in line with how the muscle penetrates, right, or is spread out. Right, that's good there. We're going to move on to the paraspinal muscles next. So I'm not applying direct pressure onto the low back, right, just along the side of the spine. We're going to move up a little bit. So think like your middle back. So just directly to the side of the spine, think like spine is here and then the muscles are right to the side of it. These muscles help you, right, flex and extend, and also laterally flex and extend to your spine, your back muscle, or your back. So these muscles here, I'm going to start in the middle back, so kind of like right where my ribs start, right? We found the bottom rib before, so now we're going to work on starting at where that lowest rib is and working our way up instead. So dig in there best you can. These middle back muscles I can already feel, my paraspinals are already definitely tension. I have a lot of tension, are definitely tight. So I'm going to dig in there. Sometimes I like to rock side to side just a little bit too, right? Rolling over and across the muscles. But these muscles, like we talked about, they run up and down, so it can also move along with it as well. So let's move up the spine just a little bit here too until I get to just about below the shoulder blades, right? If you feel that tension, right? Dig in there. This is a very common one for like massage therapy, right? You go in to get a massage, lay face down, they're going to run along the paraspinals. This is a really good one to attack with the ball here. All right, that's good for that side. Let's start on the other side. Again, I'm starting at the lowest rib and working my way up, okay? Feel free to start there. Again, on the side of the spine, muscles that run along the side. Make sure you're kind of pushing into it. And I can start at my lowest rib, move my way up, scour around, search around. If you find a spot that has a lot of tension, oh yeah, I just definitely found a knot or trigger point. I can almost feel it starting to release a little bit already though. Lean back a little bit. Again, exploring around, finding where you're tight. All right, and then I can move up just a little bit too. I'm going just below my shoulder blades for now. Search around these muscles. Yeah, not as tight up top. Spend just a little bit more time here exploring on this second side of your paraspinals. Then we're going to move on to the upper middle back. All right, that's good there. We're going to move on to the upper middle back, rhomboids. Still, right, there's definitely paraspinal muscles that run along the side of your spine in your upper middle back as well. But there's a lot of muscles that overlay on top of that too, right? Rhomboids and your trapezius muscles, mid-traps. So we're going to start here. Think about now, I'm right where my shoulder blade is. So I'm going to lay back with that ball just between my shoulder blade and my spine. Another key point is, as long as you can, it's not too much tension for you and you can support yourself, you can pull that. I'm protracting my shoulder blade, pulling my shoulder blade out, right? So as I pull my arm across, right? To kind of expose some of those rhomboid, paraspinal, and trap muscles so I can dig in there too. As always, just scour around a little bit. I'm going to move up and down. I can move out and into now that I've opened up some more muscle tissue by moving my scap forward and across. You can dig in there. These muscles, like I would say on most of us, right, for different lifestyle reasons, they're all the same, right? Because we all end up sitting, all end up driving. That's the reason why we're all probably going to be a little bit tight in your upper middle back. Okay, so spend some time digging there. As always, if you find a knot, just hold on to it. Just scouring around, seeing where we're tight for now. One other method I like to use too is I lay back, and then I sit up, right? Lay back, sit up, and as I sit up, I can move the ball just a little bit. Lay back, yep, definitely tense there. Sit up, move out to side just a little more, lay back, sit up. Awesome. All right, so that was the first side. I feel like I could spend all day there, but we have to move on. So I'm going to get to the second side here. Put the ball down. Make sure it's between my spine and my shoulder blade. Good. I'm going to protract, pull my shoulder blade forward, and then I'm going to bring it over and across my body. So that gives me some more space to work with. Just going to scour around a little bit too. Dig in, search, try and see where you feel some tension. Yeah, raising your hips up can help push down just a little bit harder too. And as always, the sit up, lay back, sit up, adjust, lay back can help you scour around as well. Awesome, let's dig in just a little bit longer here. Again, I feel like I could do this one all day. Another very common spot for massage to work on. And beyond that would be like your upper traps too, right? Massaging your upper traps, definitely another super common one. We're just hitting the middle traps right now. It's a little bit on the lower traps too, but. All right, Well, that'll do it for the spine there as well. Great job. So using a lacrosse ball, great option for the spine. It's not too dense, not too hard. I'm not compressing any nerves. If it was too tense, you can use a tennis ball. And then again, your other option was to do all that spine stuff instead of laying down, was to do it standing up against a wall. All right, team, well, that'll do it for our workshop on trigger points, focusing in on the hips and the spine. Use the tools I gave you wisely, right? I hope you guys learned something about how to help release your trigger points or the knots in your muscles. Just general protocol recap is that I want you to search around using the tool that you have, the lacrosse ball, the softball, the golf ball, whatever it is, either on the floor or leaning up against the wall. Search around in those muscles until you find a point of tension, right? That's the trigger point of the knot. And then breathe through it, relax, try and loosen up that one specific spot. You can hold up to about 2 minutes. Move around. I would definitely encourage you to incorporate this into your overall routine of focusing on stretching and recovery methods. This was really great, but if you do end up feeling a lot of pain, just be careful. I don't want you to be compressing any nerves. And if some of your trigger points and pain points are extreme, right? Pain is a signal that you need to go see a medical professional, so please do so. All right, well, thanks for joining me. Again, I'm Coach Luke Rudberg with Training House. Follow me on Instagram at Coach Rudberg and on Facebook at Coach Rudberg. Thank you.